Hello, everyone. I would like to welcome the participants of our today's webinars. We are very happy to those who are to see those. To see and to listen to those who are joining for the first time. We are equally happy to welcome those who have been joining our previous webinars, and we hope that they were useful for you. Because we launched quite a lot of new social media activities, and we have a lot of new participants today. We are briefly going through the activities that we've had so far and about the resources that you can use in today's webinar. We started our webinars in October in 2019, and we held, to date, we held 14 webinars. And today our webinar is number 15, which is quite a little, it's a little bit of anniversary. The reason why I'm showing you the information about our previous webinars is because you can find the recordings of all of our webinars either on our webpage. In your invitation, you have the link to our webpage. There is also a dedicated webpage for webinars. And you also have a LinkedIn showcase page where you can follow up all IC Health activities. We welcome you to use those resources along with these groups of the social media, and we have a dedicated Facebook community, and you're welcome to join it as well. Again, you have a link to that community in your invitation that arrived by email. So today's webinar is number 15, and we will be talking about creating comprehensive policies and procedures for healthcare facilities. This is not the last webinar. We will be having more webinars, and we'll announce the exact date and topics as soon as we have them confirmed. One little announcement. Most of us are still on home-based work, and the thing is that not all of our not everybody at home understands that this is our office at the moment. So you may be hearing some stranger noises like meowing and barking, and this is a part of our reality. We are working and they're having fun. So please excuse if this comes during our conversation like it goes now for me. I sincerely apologize for this. Yes, you could hear my cat. Okay, so some useful functions that you can apply in today's webinar, in addition to our our usual resources. In the bottom of your screen, you can see the chat function, and this is where you can click on it, and you can post your, you can post a message to either everyone or to a specific panelist, or it's here you have the option to select who you would like to send a message to. Also, there is another function called questions and answers. This is where you open and you have you can ask your question. You can type in your question. If you type it in your own language, then we will do our best to translate it right away, and we will respond it, and our response will be interpreted by our interpreters. But also all the questions and answers that you post here will be recorded by the system. So we will keep a log of all those questions. And if you require an additional answer, or if we do not have time to respond to your question, then we will still have it as an open question in our log, and we will be able to answer it directly. So for interpretation, please use the icon below to the right of the questions and answers and chat. This is called interpretation. When you press on that icon, you can see the languages that are available, and you can select the language that is applicable to you, that you understand best. Once we finish the webinar, we always want to hear your feedback. I mean, we want to hear your feedback during the webinar as well, but unfortunately, it is very difficult for us to monitor the speakers. I mean, if you speak, so this is why we ask you to ask the questions and to chat with us in writing. But when we finish the webinar, this is a good time to connect with us, sending your feedback or filling out a survey on exit. This is when you press the leave button in Zoom when you want to leave the webinar. You will have 3 questions and an open-end question that will be where you can write your request or your preference, or ask me, please contact me at this email or here, and I would like to chat more. If you do not, I mean, if you miss this opportunity, or if you do not have time to do that, then we will send you the materials that we use in today's webinar via an email, and you can respond to that email saying that I'm satisfied with the webinar. And of course, this is a good sign for us. If you're satisfied, then we are doing right. If you're not satisfied, or you have additional requests, or you would like to amend, you would like us to amend something, then we need to know that in order to do that. So that's basically it. And I'm passing the floor over to our speakers. Today's webinar is about creating comprehensive policies and procedures. Thank you very much.
Thank you very much, Natasha. So hello, everyone. Good morning, good afternoon, good evening, depending where you are. Welcome to IFC series of webinars. My name is Julia Kalimova. I am IFC specialist in healthcare quality and patient safety, and usually the moderator of this webinar, sometimes a speaker. Personally, I'm super excited today because we're having a webinar jointly with Joint Commission International, together with Joint Commission International, on such an important topic as how to develop a good policy. We all understand that creating documentation, specifically such as policies and procedures, sometimes is extremely challenging. And that's why we need to focus on this and pay a lot of attention to it. So today we will have 2 speakers, 2 principal consultants from Joint Commission International, that's Maral Atechan and Francine Westergaard, and also myself, Julia Kalimova, and Ajibiki Oyumi. We will be kind of panelists sharing our experience and sharing lessons that we learned, because both of us, we are currently assessors together with IFC IQ Quality. We are part of the IFC quality team, but we both had experience of working as the quality manager. Myself, I was working in a very large, actually the largest healthcare chain in Russia, and Ajibiki was working as an so currently she's ex-quality director in Lagoon Hospitals, Nigeria. So please get ready to listen to our speakers. And Francine, over to you, please. Francine, you are muted, sorry.
So sorry for that. Okay, I would like to, Dr. Morale and I would like to personally thank the team at IFC for the opportunity to participate in this webinar. We are delighted to be here with everyone today. We'd also like to thank everybody that's calling in to listen and learn from this. And we'd like to thank the interpreters as well. Today, we're going to be talking about policies and procedures. So our objectives are to define the different components of a policy on policy. We call this the mother of all policies because it really helps establish the framework for the documents within your organization. We're also going to define what's a policy and what's a procedure and how to structure those. We're going to discuss the purpose of policies and procedures. We'll list some of the key components of those documents, and will identify the connection between your policies and quality and safety work within your healthcare organizations. So let's jump right in and let's start with the definitions. Very clear, very concise. These have come from our Hospital Standards Manual, 7th edition. A policy is a statement of rules and principles to guide decisions and actions within the organization. It is the what of what's required. So when you think about your policy statement, it should be clear, it should be concise, and it should be well understood. Many times we recommend that you perform an exercise that we call 15 words. Can you get this policy statement into 15 words approximately? And that really helps the team think about what this policy statement should reflect. And then the procedure is the how does this happen? It's the specific way of performing a task, and it usually includes step-by-step instructions to comply with the policy. A lot of organizations will keep these two combined on one document. However, we have worked in countries where the actual laws and regulations require that these two statements be on different documents. JCI is not particular or prescriptive on that. We just want to know that you have a clear definition, that's the policy, and then an explanation, that's the procedure. So overall, the purpose of policies and procedures is a way of communicating information within your healthcare organization. Policies drive behavior. So they provide your staff with business and clinical rules and guidelines to give them instructions on what should be done, how should it be done, who should be doing this, if it needs to be documented, where is that information documented, and what's documented. And really what it's doing, your policies and procedures, really what they're doing are ensuring consistency and compliance with your organization's strategic plan and what your mission for healthcare delivery. There are some key elements of policies and procedures, and this is really important. You want to identify your tracking. That's your identification and tracking number. There's different methods that you can use. I can tell you what we don't suggest. We do not suggest that you use the standard chapters. We don't suggest that you use the standard numbers in your tracking mechanism because our standards manuals are revised and update every 3 years. And so if there's any changes, that would require you to go back. We really encourage you to use different methods for tracking. So some suggestions might be the list of your affected policies and procedures. Your tracking might include the scope, including all of the different systems, all of the different locations, all of the different departments, all of the different categories, clinical, administrative, maybe your policies or documents from outside of the organization. For example, if you have a transplant program, you're following laws and regulations on transplantation. You'll want to have an identification codes. Your identification and tracking will also include information such as when the policy was posted, when it became effective, maybe when it was approved, when it was revised, when it's due for its next revision, expiration date. So all of this is important in your identification and tracking. You also want to have the explanation of the policy, the explanation of the procedure, and then the elements that reference other documents. We're going to get into this with more detail throughout the rest of the discussion today. So why are policies and procedures important? They are going to help your staff understand how your organization functions. We do have a workshop on this topic, and what we do, the way we project this is think about your new staff person. They've just completed orientation. They're working their first shift. It's a Saturday night. They're no longer being supervised. They've completed their orientation, and it's a crazy night. Lots of admissions are coming in, patients are decompensating, and they have a question. Their teammates are busy with hands-on care. Where do they go to get that information that they need? It should be well-defined, well-described in the policies and procedures, and they should be able to access and locate those documents easily, get through them quickly. So think about this as you're naming your documents, as you're filing your documents, if they're paper, if they're electronic. So these documents describe how your organization functions. Again, they're the rules and the methods of operation and the healthcare services that you're delivering. Your internal controls refer to the process that you have in place that help ensure that you're safeguarding your patients, that you have efficient operations. It also, your documents complain how you control your assets. How do you maintenance, manage, inspect, and repair your assets? Your documents also help you achieve goals. For example, your documents might describe the care planning process. How does that occur? How does the multidisciplinary team communicate? And it also includes reliability of information that's being reported. Your documents in the reference part will, excuse me, reference any laws and regulations. So your documents will help you stay compliant within your own laws and regulations, within your country, within your region. So all of these elements form the framework of your leadership of proper governance and successful healthcare practices. So with this, what I would like to do is turn to my colleagues for additional comments.
Thank you very much, Francine. So now we will ask Dr. Ajibike Oyumi from Lagoon Hospitals initially, but now our IFC assessor, to share her journey on the development of policies, because Lagoon Hospital received accreditation by Joint Commission. So I'm sure she has lots of stories to tell you and lots of life hacks and practical advice. Ajibike, over to you, please.
Thank you, Julia. Good morning, good afternoon, everyone. I'm in the morning section, part of the world. Good afternoon. I can see a few of my colleagues from Lagoon online as well, but to everyone. Yes, it was a very interesting, or it's been a very interesting time, working around policies and procedures in the hospital. I remember, when we started out in 2007, trying to develop policies and procedures. We didn't have any previous experience, and we had no one with prior experience, around us. And so we had to do a lot of searching online. And I remember the staff, of course, because nobody knew what to do, but we have somebody who's being appointed a quality manager. It must be your responsibility to go and develop those policies and procedures, which was what we did. So myself and the quality manager that worked with me would sit in our offices late in the night, and we're poring over the internet and finding policies and procedures, documents that we could use as templates. And we will, by ourselves, pound out those policies and procedures without consulting the stakeholders. We knew nothing about it. So they were our own policies and procedures. No wonder nobody paid attention to them at the time. Nobody would read them because we didn't consult them. But the truth of it is we didn't know better. Gradually, we began to learn, about consulting stakeholders, but we didn't do it in a consistent way. so we didn't have a policy on policies, as it were, right? We didn't know that we needed to do it consistently. So one policy looked one way, another one looked at another way. So thank you, Francine, for talking about, having a structure and a template to use, because that was a major challenge for us. We would use whatever template the one we were borrowing used. And I guess we ended up confusing a lot of our staff at the time. But definitely, we got better over time. The other thing that Francine has spoken about that I think many organizations I find make mistakes is linking the policy directly to the JCI standard. One, of course, the standards change. So you may end up losing track of it. But the second challenge that I found was that it linked the policy very firmly to JCI accreditation in the minds of the staff. And so once the JCI surveyors had come and gone and we got the gold star, it's like, forget about it. This is about JCI. It's not about the organization, which is not what it should be. The policies and procedures are meant to guide action that lead to delivering efficient, quality, safe care. And so, I had to say at some point, we need to take out the reference to JCI from this so that the staff don't get fixated on policies and procedures as being about JCI, because it became about JCI and it became about the quality department. It's your policy, your procedure. You made us write it because you want us to get JCI accreditation. So, that psychological piece we have to manage. So I was really pleased to hear you talking about try not to link it to the JCI standards, And the other part of it is, how to manage that. And I see that that's the next topic. So I wouldn't say a lot about that at the moment, because managing those policies and procedures, making sure that they are on point, current being the word, current, and being able to manage the obsolete, whether it's in paper form or electronic form, and making sure that people know when you have updated and all that is another challenge that I know the hospital faced for a long time and still haven't overcome completely. So I'm sure they'll be glad to hear how that would go. Okay, so let me hold on and let you continue going. Thank you.
Thank you.
Thank you very much, Ajabike.
Yes, thank you, Ajabike. I really liked your point about this is about our organization. This is not about JCI, because really what a JCI accreditation survey is about validation. It validates that your organization has a framework in place for quality, for patient safety, and your documents are what actually, as I said, drive that behavior. So now let's begin talking about writing and managing policies and procedures. Standard format. So you define what your format is going to be for your organization. And what we want you to consider are maybe these three major sections. The top section of the document would be your control section. That includes the title, effective revision dates, your filing number or your unique identification number, authorization information. All of that information would go up in that top section. In the middle section, that describes your purpose, your definitions, your responsibilities, the policy statement, the procedures themselves. And so this is where I want to start getting into more of the granular details. Something that Maral and I have observed throughout our years as consultants, some tips here. Definitions. As you're writing and or reviewing your policies and procedures, cross-reference your definitions to make sure your definitions are consistent across the organization. Make sure that when you are talking about responsibilities, you're talking about group. Don't use names of individuals because sometimes people win the lottery and they can retire. So think about groups of people. And then the lower section includes references, any histories of changes, any attachments that you might have. And your references should be very specific. You know, this is not where you would just put JCI 7th edition hospital standards. This is where you can get more detailed about which standards or measurable elements, because it's only the reference part. And as you revise these and update these, then you can make the appropriate corrections to them. There have been some questions that come up frequently about attachments, the use of algorithms, things like that. We do encourage the use of those types of attachments, particularly in processes that might change, because it's easier to change an attachment such as an algorithm than to have to go through and revise the entire document. So think about how you're going to structure this documentation system for your staff and include these sections and then the different attachments. Let's start talking more about the policy formatting. In your title, you should use 2 to 4 words. Don't have long, wordy titles. We encourage short titles that are searchable, that really pull out the essence of the policy and the document, the procedure. Your dates, we've talked about those, the initial date of the policy, the revision dates, any review dates, maybe something's been updated mid-cycle. Your purpose, give a short description. Again, your definitions, clarify any terms that you're using, make sure they're consistent across the organization. This might also be the place where you put your abbreviations. If you're going to use abbreviations, you might put those words in the definition section, and then you can use those abbreviations throughout the document. Again, being consistent across the organization. Responsibility, who must comply. The activities, what are the steps, what are the requirements. And then your references, your laws, your regulations, any evidence-based publications that you're using to reference should be here, your attachments. The length. Questions always come up about how long should our policies and procedures be? And it's very, very interesting. Having done this with JCI since 2007, I've worked with organizations through many, many cycles. And what we see in the beginning, many times, organizations will use a lot of cut and paste. They do a lot of research, they lift what looks like really good information from other organizations, put it in their documents, but it doesn't really explain clearly, as Ajibiki said, it doesn't explain clearly to their staff what they should be doing in your organization. So shorter is better. If you find over time that your documents are growing in length, break them up so that they're not too lengthy and not too wordy. A good policy writer is worth their weight in gold, you know, because they can really create a strong document for your staff. And remember, the policies and procedures are for staff to quickly access, learn from, and follow. So here's a sample policy and procedure for sedation for non-anesthesiologists. So maybe this might be used in GI lab, cardiac cath, it might be used in the emergency department. And here you have a nice policy statement. You have the purpose, and then you could have your definition for moderate sedation. And then you have responsibilities, your scopes, your procedures, your references. The attachments might be examples of different forms that are used. So here's a template. And also, you will, following this webinar, receive an example of a policy on policy from the team, the IFC and the JCI team. So we hope that you'll find that as a reference useful and helpful. Numbering and labeling. There's a number of different ways to number and label your policies. Oftentimes what organizations will do is they'll divide their documents into 3 separate groups: clinical, operational, and external. I gave you one example of external for transplant organizations. Other external documents might be your documents for disaster management. We've all learned a lot about disaster management again this year when it came to the pandemic. So we're not saying you have to do this, but many organizations will do this because it helps them with the review cycle. How long should organizations go in between review cycles? We are not prescriptive. JCI is not prescriptive, but most organizations follow a 3-year cycle because that's the accreditation cycle. So year 1, they might review all of their clinical policies. Year 2, they might review all their operational policies. In year 3, they might review all of their external documents. Again, it's for you to decide. The more structured you are, the easier this is, the more efficient you are, the more smoothly the process flows. So number and name each policy so staff can quickly locate them. I'm kind of hammering that point. After numbering each policy, you might want to list them alphabetically. We don't have requirements on whether or not these documents need to be electronic or paper. Again, that's your decision. If you go electronic, if you make the decision to go electronic, think about what you're going to do if there's some type of cyber assault that's happening frequently across the globe. I've worked with organizations in the Caribbean and in Europe that have had cyber assaults within the last 2 to 3 years, and it's really taken down their electronic system. So if that happens, how will your staff access these policies, particularly the policies on what to do during an unexpected downtime? So we've talked about this, the definitions. We use a lot of P's: policy, procedure. So we've talked about these particular definitions, but your policies and your procedures together lead you to processes and protocols. So a process is a series of actions or activities that transform the inputs, your resources, human resources, your technical resources, such as maybe infusion pumps or ventilators, into outputs. So transforming inputs into outputs, patient care delivery. And then a protocol is an example of a scientific treatment plan or a study outline. A protocol is another example of what you might consider using for an attachment. A protocol for use of your guidelines, your clinical guidelines. Oncology programs are very, very good at using protocols. So policy procedures lead to process and might include the use of protocol. Does this look familiar? Anybody familiar with the PDCA cycle? Our policy management process is very, very simple and very, very similar. It begins by writing your policies and procedures. And as Ajabiki said, you don't want a group doing that independently. You want to involve the frontline staff. Before joining JCI in 2007, I worked for 23 years in a system of hospitals in Chicago. And we had a lady that was very skilled at this process, and she would pull a group of us together in a room with a large white wall. And she would bring into that room many different sticky pads, and we would describe the process, and she would write furiously, and we would put them on the wall. And then we would look at it and we could move those sticky sheets around. And so that was how we started the process. That's how we wrote the policies and procedures. If we had an adverse event and a root cause analysis and we had to revise our documents, we would do that. And then we would actually put it into writing. After that, we would begin the implementation phase. And we received a lot of interesting questions prior to this webinar that people wanted us to discuss. It's really interesting because 75 to 80% of those questions fell in the bucket for writing the policies and procedures. The rest fell in the bucket for implementation, management, and monitoring. The majority of policies and procedures fail, though, not because of poorly written. That's one of the reasons. But the majority of them fail because of gaps in the implementation stage. So please make sure you have a good plan for implementation. We're going to talk about that in the next section. And then monitoring. How do you make sure that those policies are well implemented, that the staff understand them, that they can follow them, that they have the necessary resources? So that takes place throughout the lifetime of the document, and then maintaining them. Maintaining them is all about the regular review by the users and the leadership team. Challenges and strategies. So I worked with an organization in South America. It was well over 100 years old, had a large history. It was a large organization. It was an academic medical center, and they were overwhelmed when they first began preparing for JCI because they didn't even know where to begin with the policies and procedures. They had thousands of them, and each department wrote their own policies and procedures. So they had 6 or 8 different policies and procedures on resuscitation alone, on reanimation alone. So first thing you have to do is do an inventory, and that's a lot of work. But sending out an email and getting an inventory from all the different departments on their policies and procedures. Once you've done that, you need to research best practices. You need to really take a look at your hospital's needs, your organization's needs. As you're reviewing your documents, you're going to take a look at what needs to be included, what's essential, and what could be eliminated from these documents. When you have an older organization with a history of many, many documents, those documents change for many reasons. They change because of practice changes. They change because there was an adverse event and somebody says, oh, we need to do this. And so many things get added in throughout the years. And this is a real good time to do a deep dive into the documents and say, are all of these steps necessary? Standardizing your template or your format, as Ajabiki said, that's really important because numerous different formats can be confusing for the staff. Engage relevant leadership, management, and staff throughout the process. Create that policy of policies that we've talked about, and then have a regular review schedule. So, writing your policies and procedures. What are some of the do's and don'ts? And this is where we get into the meat of it. Plan on 1 to 4 hours per page for each of your documents, from the start to the final edit, 1 to 4 hours. So this will help you think about how much time and the human resources you're going to need to dedicate to this process. This helps you quantify it for leadership. And then that way leadership can have a good understanding of how many people and how many hours it's going to take. Again, ask the staff how they are now implementing activities in their practices that can relate to the standards, and then learn more from your subject matter experts about the document. Don't go to, some of the don'ts include, don't go to another hospital or a source and then just change the name of the policy and the procedure. We do encourage you to read other organizations' policies and procedures because they do contain good information. But you need to put in place steps that will be specific to your organization. So read them as a reference only. Don't cut and paste your name onto somebody else's document. That's not a good practice. Tips for writing policy statements. Write in clear, concise, simple language. Define the rule, not how to implement it. This is the policy statement. So define the rule. The implementation goes in the procedure part. Make sure it's readily available. Designate a policy expert. That might be the department chair, that might be the department nurse manager, that might be the laboratory manager, they might be your policy expert. Define it by title, not by person's name. Provide standardized specific steps for implementing your policy. Remember, as I said earlier, who performs the process? How do they do it? What tasks are necessary for performing it? When do they perform it? How is this information documented and recorded? Where does that information go? And think about who else is going to be reading that information, particularly if it's in the patient's medical record. Will they have access to it? Will the entire team that needs that information have access to it? And then make sure that your documents are concise, specific, and understandable. Again, I talked about the use of abbreviations briefly. That's where we see a lot of failures, because if there are a lot of abbreviations that one department is very familiar with, but others are not, that can be problematic. All right, roles and responsibilities for all these different folks. Top management. Top management should be providing guidance for what documents are in place. They should be reviewing drafts. They should be reviewing the overall scope. Your frontline leaders, though, are the folks that are actually putting these processes in place, so they should be heavily involved. Do you need a policy and procedure committee? We can't answer that question. You have to answer that question. We don't require it. However, most organizations will put one in place because it is the most efficient way to move all your policies and procedures through. However, again, I want to emphasize it's not necessary. Some organizations will use their quality committee in the very beginning, just to make sure that it's getting an appropriate review and oversight. And then eventually they perform a policy, or they form a policy and procedure committee. Again, that's for your organization to decide. And then please always, the frontline staff are there to help define, they're there to help put in place the necessary implementation process, and to help make those policies and procedures successful. There should be a structure in place for approval. And that structure would review the document. They would send back questions to the folks that actually put the document in place and wrote it. The structure for approval will also make sure that leadership is in agreement. That might involve a leadership signature. And that structure will also include, when it's necessary to review things, that approval process might also include when there might be recalls, product recalls. So that whole approval process should be well defined in your policy on policies. And here's an example of policy structure. This is from an organization that was preparing for JCI accreditation. What they did was they broke the teams down by chapters and departments, and those different teams created policies and procedures. They cross-referenced with the other chapters that had similar expectations and measurable elements. This all went through a corporate, this was a large organization with many healthcare facilities. It went through a corporate committee. And then there were many, many steps. You can make this as complicated or as simple as it can be for your organization. And with this, what I would like to do is hand it over now to my colleagues for new comments.
Thank you very much, Francine. It was very interesting and very useful information. And now I'm gonna share a little bit of lessons that I learned from a little bit about my own journey. Because personally, for me, I would say this is where my quality started, healthcare acquaintance with quality in healthcare. So it happened 12 years ago. And as I said, I was working in healthcare management in largest Russian network. And suddenly the management said, guys, you will need to get accredited and receive international accreditation, most likely Joint Commission. At that moment, awareness in Russia about quality in healthcare was low, even maybe below zero, I would say. So we realized we need a consultant, and the management invited an international consultant. Now I understand that he was not super great, because our work with him at first was a little bit of comedy and a little bit of tragedy. We were making 2 steps forward and 5 steps back. So regarding the policy, first of all, it sounds absolutely similar to politics in Russia. So nobody could understand what he actually wants from us. So he put us all together in one room and said, guys, step 1 in preparation, you need to write the policies. And doctors started like, it has something to do with politics. It must be maybe governmental documents and regulations that he needs us to bring in and write down. So I must say in Russia, the system is highly regulated. So we have various codes like hospital construction code. So it describes everything, how to build a hospital, how to equip a hospital, how to provide services. And the language is very complicated. And also it's all kind of prescriptive manner. So you should do this, one should do that. And of course, it's very generic. So what we decided to do, okay, infection control. We just take instructions. In Russia, they are called instructions for healthcare facilities for infection control and prevention. And doctors realized that everything is important there. So they just started to copy paste. And as a result, our policy looked exactly just like scanned copy of the regulations regarding infection control. And we bring it to the consultant happy. And we say, is it it? He said, oh my God, this is terrible. This is not what you were supposed to do. It says, like, for instance, if the patient, you suspect an infection with the patient, he should be isolated in the designated isolation room. So he said, that's not right. I'll bring you samples of the policies from Saudi Arabia and you will adapt it. We said, okay. So he brought the policies and we say, adapt. It means what? He said, well, look, if it says ICU on the 4th floor, and in your case, ICU is on the 2nd floor, just change the floor. Or if there is nurse Iman in Saudi Arabia, in your case, it will be nurse Maria. So we started to do that as well. So it sounds terrible to me now, but at that moment, we didn't understand. We were in complete darkness because nobody explained to us what we need to do and what are we expected to deliver as a result. So then, after we developed that as well, the consultant again said that we are very poor students, that he gives us poor marks and resigned. And at that moment, I realized that I need to learn myself, and that's how my quality journey started. And I realized that basically we need first to develop a process with the stakeholders and then describe it in the written document. So this is the lesson number 1 that I learned. Because at first, being in the quality department, we were actually the people adapting these policies, because doctors immediately said to us, look, we are not coming from Literature Institute. We don't know how to write. We are not poets or writers. So write it yourself. But we could not describe a process because we didn't know the process. So the second lesson that we learned is actually you need various stakeholders and a multidisciplinary approach. You need to work with staff from the departments on developing the process and describing the process, because only in this case it will work. So then I also realized that actually policy is a very useful document, because when staff member leaves and the new staff member joins, they easily fit into the system. They read the document and understand the rules and procedures of the medical facility. And that's actually the purpose of it. Say you have a wonderful head nurse, she knows everything inside out, and then suddenly something happens to her. Some other hospital invites her and she resigns within 1 day. And then you realize that the system is gone together with her, because you cannot rely on a human factor. So basically you describe this process together with your best knowledgeable staff members, and then you have it forever, no matter what turnover you have. That's the value of the policy. Also, as I said, the lessons, so the first step is not even developing the process. The first step is explanation, what needs to be done. Then staff become very helpful, because I see now already from my experience as an assessor in IFC that staff perceive document development as additional red tape, but actually it's not. It's not red tape. It helps them. It gives them guidance. It helps them to protect themselves from making human mistakes. Because if there is no description what to do in a certain situation, they have to make their own judgment. And if that judgment is wrong, then they are to blame. But if there is a clear instruction regarding what to do in a specific situation, they are always protected, because they say, we just followed the instructions, we followed the procedure or the protocol. So that was a little bit of life hacks and tips from me. And now back to our Joint Commission experts.
Thank you, Julia. That was perfect. And we could really appreciate your experience. Thank you for sharing that with us. So here is an example of policy procedure development and approval tracking process. This organization actually put some definitions to the time for each of these different steps. And the reason that they did that was so that the documents would continue to move through. And they could actually monitor how well they were doing with the writing and the approval, the review process and everything. So they really got quite definitive on how their documents were managed. So what happens now after your document has been approved? What's the next step? The next step is implementation and evaluation. And here's where you have to develop the training and the orientation materials, keeping in mind that you might be training staff on numerous different shifts: day shift, evening, night shifts, week shifts, weekend shifts, staff that might only come in and work weekends and holidays. So you have to have training and orientation materials for the staff that is appropriate for the information in the policies and the procedures that you're training them on. You also have to define the measures for monitoring the results. So for example, I talked about that organization in South America that had numerous policies on resuscitation. Our JCI standards are very specific and say that you have to have a response team that brings advanced life support to a patient that needs it within 5 minutes. So that information was defined in their policy, and it gave them a measure that they could monitor. Was the team for advanced life support arriving within 5 minutes? Did they have all the necessary equipment? Could they document everything? And then they could actually monitor their policy to see if this was happening. So you develop your training materials, you provide orientation to the staff, you define your measures, how you're going to monitor it, and then you want to pilot it. You want to test that new procedure, particularly if you're a large organization. You want to pilot it in a specific department or 2 or 3 departments in order to determine whether or not that policy and procedure is something that the staff can actually do. Because many times we write these policies and procedures, we think we have a great document, but then when the staff try to implement it, there are some barriers in place that we had not anticipated. So you pilot test it, you put in place any tweaks, any last minute necessary adjustments, and then you begin to communicate that new policy and procedure to the entire organization, full implementation. And then you monitor and measure it. So these are the steps that you need to have in place for implementation and evaluation. When Dr. Morale and I work with organizations, we strongly encourage them to put together a communication plan for the implementation of these policies and procedures. Different people, different groups in your organization receive and intake information in different ways. So think about who's going to be receiving this information. Physicians, nurses, kitchen staff, laboratory staff, radiology department, social workers, and create your communication plans specifically to each of these groups. Do they need to hear it in email? Can you post memos? Do you put little tickers on the bottom of all the computers? Do you have information delivered at staff meetings? Do you have one-to-ones? Do you use a combination of all of these different methods? You cannot communicate enough. All right, and if you're putting together a train the trainer program, then you really have to go out and monitor those trainers to make sure that they're communicating the message as you intended it to be delivered. Because the more people you have in the communication chain, the more opportunities for variances in deliverables. So make sure that you have a well-developed communication plan, that you have good strategies for implementation, because all of this is essential to the success of your policy and procedure implementation process. We did give you an estimated time frame for developing documents, anywhere from 1 to 4 hours for a single page. That is 10% of the development of your policy. So writing the document, getting those in place is actually 10% of the process. The other 90% is the implementation process. Getting that information out to the staff, making sure they understand the policy the way it's intended, and then monitoring the process, and then the continuous review cycle of the documents and the process itself. So please keep this in mind and make sure that your implementation period is well designed, well structured, and going to be efficient and effective. Okay. Plan the implementation, make sure the appropriate individuals are involved in the development of the policy and the development of the implementation stages. Think about who's going to develop and present the education. Some people are great at presentations, others, I remember when I first started presenting, I would get all red and blotchy. And so, figure out who's really going to do a good job. Do you need a team of people to do this? Do you need to partner a nurse and a physician together? Do you need to have demonstrations of particular pieces of equipment? Will the staff need to do a return demonstration, for example, in resuscitation? And then think about what is the realistic timeline for your implementation. So all of these things need to be planned and put in place in your implementation phase. So as I mentioned, there are reasons why policies and procedures fail. And some of these reasons are reasons that organizations get cited during surveys, out of date. So make sure that if you do have an electronic program that stores all of your policies and procedures, that you include information on how long something is considered valid after it's been printed. So if somebody goes and they look up something and they want to print it out and throw it in their pocket for use, how long is that valid for? Organizations sometimes say 24, 48, 72 hours. Other reasons for failure include policies, procedures that are too long and too wordy. As I mentioned before, many times over the years, our policies evolve and they get bigger, they grow. At a certain point, you need to think about, should this be broken down into 2 or 3 policies? Policies that are poorly designed, or you have multiple formats throughout the organization. Policies that are lacking some of the different components. For example, I can go into an organization, if I go into different departments, some departments are real good with the definition portion, the definition section of the document, which is, I think, a very important part of understanding the procedure part of the document. And then I'll go into a different department in the same organization and they don't use definitions at all. They say, well, everybody understands this in this department. And we can't make those assumptions. Other reasons why policies and procedures fail is because they're hard to find, They're hard to locate. One of the first steps during a JCI consultation or a JCIA survey is a review of the documents. And then when we go out and we ask the staff questions, we ask them questions that are specific to the information that's in the policies and procedures. If we find, or if we hear variation in that, we might say, can you show us the policy on that? Sometimes in those organizations, the staff will struggle to find the document. So make sure your staff can find them. If you're out doing tracers, or if you're out doing quality rounds or infection control rounds or facility management rounds, ask your staff to locate those policies just to make sure that they really know where to find them. Other reasons for failure include policies that are unclear, policies that are too generic. So these are all of the reasons that we see failures out in the field. We encourage you to learn from our past failures and mistakes and hopefully avoid them. Okay, so where do you begin? We've given you a ton of information today. Where do you begin? So create your policy on policy. If you're going to have a committee, put that committee together and have the committee form a charter. What's the purpose of this committee? Who needs to be on this committee? What are our goals? What are our expected outcomes? What are some of our measures that we're going to put in place to monitor ourselves? Who's responsible for this committee or this group of people? And who has oversight? What leadership member is responsible for us? And who do we report to? What do we report to them? So this is a good way to begin. Define all of that, put the right people in place, determine how frequently you're going to meet, and put together a template for a standing agenda. That agenda can be modified. For the meetings, you can invite ad hoc people occasionally if you're going to be investigating a particular topic, or you want to learn more about a particular topic, you can invite a guest to come to your meeting. So think about how you're going to structure this, but this is how you begin. Then you do that inventory that we talked about and you review the required documents. As I mentioned, during a JCI consultation or a survey, all of that needs to be present on the first morning. We review all the documents and the materials. We review the policies and the procedures. For those of you that are attending today that are in the process of preparing for your first JCI or any accreditation process, have the information ready, that inventory that we talked about. In addition to our standards manual, we have a survey process guide. And in the back of that survey process guide is a list of all of the required policies and procedures, including the ones that are required in English. So have those documents ready and accessible. Have somebody that can orientate your consultants or your surveyors to your documentation management process so that they can easily access these documents. And then any other policies that you feel will be helpful to your consultants or your surveyors during the evaluation process. I've included some references here for you. Dr. Morale has just completed a really big project on policy and procedure development. And so some of the resources that we've used in the past include a book, Policy Source, Policies and Procedures for Compliance with Joint Commission Requirements. This book was written for United States customers. However, the concepts are the same: infection control, medication safety, facilities management. The terms might be slightly different, but the concepts and the practices can be adapted across the globe. There's also the American Healthcare Information Management Association. They have they have suggestions for tracking mechanisms. If you're looking for policy examples or references, AHRQ, IHI, they also have some resources and some references that are available, again, not to copy and paste and lift, but for review to do, you know, some homework on, some learning on, some reading. And now what we'd like to do is hand it over for additional comments and open it up for questions. You're going to receive a copy of this presentation. We've included our contact information. And again, we want to thank everybody for participating today and for the opportunity to present.
Thank you so much, Francine. This was extremely useful. I wish I had this presentation when I was starting. In this case, it would have saved a lot of efforts for us and would have motivated us, because, you know, all these mistakes that you make and you understand you're not reaching the target, they are extremely demotivating for medical staff. And then you need to start all over again with new documents to create, and they have less and less energy to approach this. So I think this is great information and extremely useful advice. So we actually have a lot of questions that arrived. So one is a very specific question which refers to your presentation. What are external policies? So you mentioned types of policies. One of them was external. So what are they? Can you please clarify?
Okay, so I'm probably going to go silent after this question, and I will ask my colleague, Dr. Morale, to provide additional examples, but external policies or external documents might include your local laws and regulations. They might also include for organizations, for example, that are part of the EU. The EU has regulations that help guide infection control practices. I did mention for organizations that are transplant programs, if you have a dialysis program, maybe you're using documents from a local society, for example. Another example of society input where we have standardized a lot of practice might be from anesthesia societies and things like that. So any document that is contributing to your organization that comes from outside would be an external document.
Thanks so much. Thanks a lot, Francine. So I think the next question we'll address to Morale. What is a defined period for review of policies and procedures, if there is any?
Thank you, Julia. Before answering to that question, I would like just to add one more example to the external documents. We see some organizations, they have outsourcing services. And as part of their outsourcing services, they use the policies, procedures of those companies. For example, catering company or housekeeping company, they bring their own policies, procedures, which is okay. However, as we always say, you outsource those services, but you are still responsible for the outcome of the service. So you need to have some kind of oversight to review those documents and to include in your document control system. They can be developed by them, reviewed by them, but you need to have some kind of oversight on those documents. I will answer to the question related to the review cycle. What we advise to organizations to have some defined frequency to review. And the typical cycle is the cycle of accreditation. If you're getting ready, for example, now for your accreditation, you're doing like lots of work, you're developing all your policies, procedures aligned with the standards, you're doing lots of process alignments. Perhaps it's time for your reaccreditation cycle to review. So the 3 years is reasonable. And in most of the international standards, we see the review cycle of the standards is every 3 years. So again, this is another opportunity to review the standards. We do believe like the 3-year cycle is a reasonable cycle. So you don't want to overdo, so keep only revising policies, but at the same time, when you revise your policies, you really revise it as per the guidelines that that Francine just presented in her presentation.
Thanks a lot, Maral. Very important to know. Thanks a lot. And actually, one question which is related to the example that you provided of external policies, and this is something that lots of medical facilities are struggling with. If they are using external vendors, and in many countries, external vendors do not have any policies at all. But the medical facility needs to have the policies regarding, for instance, food provision, or even sometimes it's electricity supply, because they are in a building where there are other facilities and they cannot get policies from the facility level. So, I mean, from the level of the building, the maintenance company. So are there any tips or advice how to deal with this situation?
As part of the outsourcing company, we always refer to our standard under the governance leadership, where this should be part of your contract discussions and agreements. As part of that contract, you need to explain to the companies your requirement, what is your expectation, what do you require from them. It's not only the service, but as well to have those documents in place, and they need to understand why you need them to drive a safe practice, as we explained. So as part of the discussion, initial discussion, you need to include. So if the agreement is already signed and you're in the middle of your preparation, so you can put that on your cycle of re-signing the agreement as part of your indicators, monitoring indicators, that they need to have those policies, they need to ensure that they are in place, implemented, monitored, and you can assist them. Sometimes they might need some guidance, but nowadays we're seeing most of organizations, they have their own quality team within those outsourcing companies that they can as well, when you explain to them, understand what you're exactly looking for.
Thanks a lot. This is very precious tip, because this question we receive all the time, and actually facilities complain about the vendors not being eager to support them with the documents. So this is great. So then the next question actually relates to how to link. So it was Dr. Ajbiki already answered that question in question and answer section, but I still want to raise this issue for discussion, because again, it's important. So how to link policies to the accreditation, to Joint Commission accreditation standards. And actually a relevant question is, like, for instance, you showed a diagram and it said medication management and use. So medication management and use, should it be one policy or several policies under medication management? What is the common approach? This is again a question we often.
Okay. So in terms of the number of policies, if the organization is following the Joint Commission international standards, and specifically in our standards, you will find the letter P next to specific standards where we require a document, a kind of document. It can be a policy procedure or a plan or a program. So to start with, you need to make sure that those documents, we call them the required documents, are available. So you have policies, procedures in place. Under the medication management and use chapter, again, we start with a plan, which is like an overview of your medication management system. However, we do require a policy for your high alert medication, for the look-alike, sound-alike medication. So, and that's really clarified by the letter P next to the standard. So we encourage hospitals, even if they are not really having the JSA accreditation as part of their strategic goal, but to use that as a guide. Lots of effort has been put to define which processes they require a policy procedure for a safe practice. Referencing policy procedure to the document has like advantages and disadvantages. As Francine mentioned, the policies, procedures, and the standards, they might change. The numbers might change, but the policy procedure is something that will stay within your organization. So linking them together can be somehow challenging. However, many hospitals, they like the idea to have it like a reference at the end, just to help them prepare for their initial survey. For example, when they will provide evidence for a specific standard, so when they link that policy to that standard, so they show that they are ready. So you can use that as a reference, but not in your numbering and tracking system. So that will be our recommendation. Francine, would you like to add?
And I want to build on what Dr. Morale said, because it's really important that P behind the standards that require a document. That doesn't necessarily mean that each of those standards require a separate document. I observed in the beginning of the webinar that you had a webinar recently on international patient safety goals. International patient safety goals all require a written document. However, the international patient safety goals on high alert medications, concentrated electrolytes, those policies and procedures can still fall under the medication management chapter, because you don't have to duplicate them again in another location. You can cross-reference them in your reference section, and the documents, then you keep them, you minimize the number of documents, keeping them clear and concise to help the staff.
Thanks. Now that's clear, because again, as I said, many facilities, they struggle and they don't understand whether they should write one big document or a number of small documents, even if they see P in the manual. So next question is a very also interesting question from the point of view of first steps, what to begin with. So basically, the facility is asking, is it possible to parallel the process of writing policy and implementing a policy? Although we will have a separate webinar on implementation, of course, but still, can you already start following the process, or first you need to develop a policy, approve a policy, and only then follow what is written in it?
I will start to answer to this question. I mean, again, from my own experience being quality director for many organizations, and before being with Joint Commission as a full-time, sometimes it's really controversial. We are in a hurry to have a document that we want everybody to follow. However, if that document is not signed and really approved by the needed stakeholders, and especially by the executive team, there's lack of accountability, and sometimes the leadership, they might change certain things in those documents. So it's really important to ensure that they are approved, and then you take your time to train the staff before really making sure that it's effectively implemented, to start the implementation phase. So take your time, don't really rush to do things. Another example is we work in different countries, and some countries, for example, the first day of our mock survey, when we observe certain things, the next morning, we'll have like a group of people, they will come and tell us, wow, we changed the policy. What you mentioned to us yesterday was changed today. So, and we will start the implementation. Don't try to do quick fixes because you're really enthusiastic. Try to really understand the process from different perspectives, study it well, make sure this is exactly how we want the work to be streamlined, eliminate the steps that might be like duplicate steps, and then pilot it, approve it, then implement. So take your time. Don't rush to implement a process that is not approved yet, and you will lose credibility among your staff. So you cannot keep changing policies. Within 1 week, you will have 3-4 separate versions of the same document published because someone added a statement or removed a statement, and staff, they will feel like you cannot. I mean, it's not a reliable document, a policy process. From that perspective, take your time, finalize it, implement it for once, and monitor compliance.
Thanks a lot, Maral. This is actually to begin with, yeah, this is starting a new policy. And now a tricky question again from our audience. What happens, as you mentioned, change in the policy or change in the process, or policy expired? So policy expired and also certain processes changed. So what comes first? Rewrite the policy and update it and then change the process, or because there is need to change the certain things that you are doing based on the root cause analysis or some other things. So what comes first, change of the process or change of the document?
So I think I'll jump in here because there are several examples that are running through my mind right now. I've got three of them. The pandemic. Yeah, everybody recalls the frequency of changes in treatment suggestions during the beginning of the pandemic. And so organizations were just struggling to find out the right way to manage these patients that were literally dying on their doorsteps. And so in situations like that, policies are changing on a daily basis. You can't wait for the rewrites. The other two examples that that were bouncing through my mind were non-emergent, non-stress related. Well, one of them might be. So let's say you have a vendor change in the middle of a contract where a vendor says, I can't do this anymore, I'm walking out, and you have a new vendor that you have to bring in rapidly, but in the meantime, you have your own staff that are filling in. I'm thinking of a housekeeping team that walks out, or a food service team that walks out. And so you have to rapidly get those services reestablished. And in that situation, you might not, again, have the luxury of time to get those processes written down. The one example that I have in mind where you do and you should always get those processes well established might be a new piece of equipment. Let's say over the years you have purchased a number of different defibrillators or a number of different types of IV infusion machines, and you want to standardize that equipment throughout the organization. So in that situation, you would have the time and the luxury to work with your vendor, get all of your documents reviewed, revised, update, develop a good implementation plan, and then make sure all of the staff are trained appropriately. All of the old equipment is pulled, because I'm a nurse, we're hoarders, we hide things. You want to make sure that you've found all those old pieces of equipment and remove them from the organization in the appropriate manner. So it's very situational and circumstantially based, but the best practice would allow us to put the revisions in place and have an implementation process. But we also have to be, as healthcare practitioners, we also have to be very nimble on our feet and adaptable in both clinical practice and support as well.
Yes, this is very helpful. Thanks a lot, and great examples, Francine. Thanks a lot, because then you really understand the different angles. You can look at this situation from a different angle, because sometimes it just seems a little bit theoretical. Yeah, I think I can do it. But then when you start seeing the reality, like you have multiple questions. What should I do if the policy is still valid, but the process changed? So thanks a lot. This is great. Another, actually, we don't have much time left, but a very important question. I actually already touched the subject a little bit. It's additional responsibilities for staff in creating these policies. So how to combine core responsibilities of patient care with this writing, rewriting, revision, and everything. Maybe some tips from you, maybe some advice how to motivate staff and make them eager to do it, because there is resistance. That's what many hospitals right now. Yes, there is resistance. Staff leave, staff refuse. How to deal with it?
Okay, I'll jump in on this one. So Joint Commission International uses a methodology called tracer methodology. Excuse me, tracer methodology. And what we do is we actually go out into the departments and talk with the staff and learn from them. You know, what's your process for care management? And it's interesting when you use this methodology because you get to meet the frontline staff. In the beginning, they're usually pretty nervous when we come to talk to them, and you know, they run and they hide. But when you identify gaps and when you identify the deficiencies, and then you correct the policies and the practices, and you standardize it, and they see that you're actually listening to them and that you're actually involving their input, you see a transformation occur. When you come out to do your tracers, maybe they're going to start to meet you at the door with a whole bunch of sticky pads and lists of things that they think you might be able to help them with, because you have a track record of improvement, of listening to them, of making positive changes. At the same time, you're meeting people in your organization that you might not have had the opportunity to meet if you only stay in your office. So when you go out and you meet these people, you begin to identify and recognize some of those folks that have a lot of enthusiasm, and you can take them as a quality person, you can take them under your wing, you can nurture them, and you can begin to develop succession plans when positions open up, when opportunities open up. You can give them opportunities to participate in policy development, in failure mode effect analysis, in proactive risk assessments. You can give these people that are interested the opportunities to participate. Those that volunteer, at first they might say, oh no, I can't. I'm a nurse. I have to do a lot of documentation. I don't have a lot of free time. It's also management's responsibility to support this process and to give them some free time in order to do this. And that can be very challenging during situations like pandemics, during nursing shortages or other staff shortages. But when you do that and staff start to see the commitment and they see the professional growth opportunities that they have within your organization to provide input, to possibly move into the quality department or onto the infection control team, or to become a medication safety liaison, all of this really improves the staff appreciation of working within your organization. The staff satisfaction scores go up. And so this is a long-term process that requires a lot of commitment, because nurturing is time consuming. It's not easy. But when you nurture these people and you develop future leaders, you're really strengthening your healthcare organization. So figuring out who would be interested in giving this information and learning about this process, who has good writing skills. Maybe somebody doesn't have good writing skills, but they can participate in the implementation process. They're a good presenter or they're a good coach. So finding these people with these skill sets and getting them involved in the process, it takes time, but it's really a value commitment to your organization.
Thank you so much, Francine. Yeah, and also I wanted to mention that the topic of staff retention and motivation was actually already covered during our previous webinar. So those who are interested can go on our IQ Health page in IFC website and see the recording. Maybe you will find some useful pieces of advice there, which will go together with the information you got today. I think the last question for today, because we're running out of time, unfortunately, but questions just keep coming. I can feel everyone is very excited. So say a new hospital is being opened. And what would you recommend to develop policies before you actually start recruiting staff and recruit them and get them acquainted with the new policies, or recruit staff and develop policies together with them?
I'm going to ask Dr. Morale to take this question because she just had a fabulous project that was specific to this topic.
Wonderful, wonderful.
Thank you, Francine. Actually, this is a really multi-phase project. So you cannot develop all policies, procedures before hiring your staff. But again, you cannot wait for your staff members to be hired to be able to develop policies, procedures. So we do recommend that the core team, the commissioning team of the organization, start thinking of the list of policies, procedures that they are needed for to start the operation. And this includes policies, procedures related to the human resources, for example, because this is the first thing they need to do to start the recruitment process. Policies, procedures related to the facilities management, the hospital mission, vision, strategy, and guidance. So you need to start building those foundational pieces that they are really important at the high level, at the executive level. And the core team that they are hired to commission that organization will have the knowledge and the strategy in mind, the direction, how they want the business to be, to start, so to put those in place. And once you have your operational team, they will join then together to start building some of the operational documents. Sometimes what is also useful to start having some kind of general framework for those documents. But always we say those documents, they will be in a draft version or the first version. And then when you have your operational team in place, they will review it. You have your equipment in place, so you will do your alignment of your processes accordingly. What also is important to define your workflows, your patient flows, before really building those policies, procedures. And this can be done as well by the commissioning team to agree how on the model of care, on the patient flow for your outpatient, inpatient, emergency patients. And once you have those defined and your team appointed, you can start building the policies. So, but don't go to your standards of practice, to the detailed procedures, for example, insertion of an IV or like the detailed procedure till you have the right people, the stakeholders in place. And this is also important to get the buy-in. Otherwise, people, they will feel they don't belong to this organization. When they contribute to the development of those documents, they put their input, they give feedback, then it will really facilitate in the implementation phase. So the short answer is multi-phase. Some documents need to be developed definitely before the startup, and some documents after you have your team members appointed.
Thanks a lot, Maral. This is great. This is, I think, super useful advice because, again, many hospitals are struggling with it. They don't know which is the golden standard. So the golden standard is do it step by step. So before we wrap up today, and before I say thank you to Maral and Francine for their wonderful presentations and sharing their knowledge today, I just wanted to make a couple of announcements. So number one, we received a number of questions which relate to the implementation of policies and procedures and effective ways of doing it. Intentionally, we did not cover it today because today's webinar is about the development of the policies and procedures, and all the implementation specifics we will cover in our next webinar, which will be advertised additionally. So you will receive a notification about it, and you're welcome to join. Please don't miss it. We will have interesting discussion again and lots of tips regarding how to successfully implement a policy. So number two, the announcement I wanted to make is actually that IFC has now a knowledge sharing community on Facebook. So you are welcome to join. We not only share lots of useful information there, you have a chance to chat to hospitals like your hospital or medical facility in other regions. In other countries, you can talk to them. Also, you can read the publications of our team, of our partners like Joint Commission, for instance. So please join. We will share the link. in the materials that we distribute. Also, we are happy to announce that we created online training modules, and we are going to create more. They are free of charge. So they relate to hand washing practices, to isolation practices with lots of checklists, lots of audit scales, etc., and useful tips and advice. How to implement it and how to make it work in a medical facility. So we believe you will find it useful. Again, we will share how to get access to the Learning Center and more modules to come on fall prevention and lots of other things. Once again, I want to mention they are free of charge. So thanks a lot, Francine Maral. This was fabulous session, I think, and I think our audience really appreciates a chance to learn from you and also to ask you all the questions that they have been having for a long time, actually. So hope that we will have more webinars like this on various subjects. And thanks a lot to our audience for joining today, and looking forward to seeing you in our next webinars. We will advertise them additionally. So thanks a lot. Have a great afternoon, day, evening, whatever it is, and stay safe.
Thank you.
We are also looking forward to your feedback, so please fill out our feedback on a survey on Exit. It's very short, but we love to hear from you. Thank you.
Thank you so much. Bye.